Morning, guys. Welcome to episode 166. It's part 7 of ADHD and PTSD. Alright, so the dual diagnosis of ADHD and PTSD means a person meets the criteria for both ADHD and PTSD at the same time. The combination is common and often misunderstood because symptoms can overlap and mask each other. I talked about this in many episodes. So how ADHD and PTSD overlap though, specifically? All right, so for example, symptoms: poor coordinate concentration. The ADHD source is executive functioning or neurodevelopmental issues. However, the PTSD source is intrusive thoughts and hypervigilance. In terms of emotional dysregulation, which is essentially one of the symptoms for ADHD, the cause is obviously executive functioning. However, PTSD is trauma-related and it is fight or flight. Sleep problems, impulsivity, let's do that first, which is a core ADHD trait, and that's it. You know, people are impulsive. They go gambling, they go buying this and that, whatever. Everybody's impulsive. But however, in PTSD, it's trauma-driven reactions. So if you combine those symptoms together, many times you'll get either a dual diagnosis or a wrongful diagnosis or misdiagnosis. I'm lucky I have a psychiatrist who really understood me. You know, I go to her for, make sure you go to your doctor for everything. All right, so how they interact, very important. ADHD can increase PTSD risk. Impulsivity and inattention can lead to more exposure to dangerous or traumatic situations. PTSD can also worsen ADHD, so it's like in a circle, yin yang. Chronic stress damages attention, memory, and emotional control. Together, they often amplify anxiety and depression, which is not clinical depression. It is an environmental caused depression. Substance use risk, executive dysfunction, not able to achieve your maximum capacity, and emotional overwhelm and burnout. Treatment. Let's go through the medication first. ADHD meds, stimulants or not. Most likely, or most of it is stimulants, may increase anxiety, however, or hypervigilance in untreated PTSD. Now, I'm going to ask my psychiatrist about this, actually. They're SSRIs and prazosin, Prazosin, for those who are interested in pharmacology. The PTSD meds, that's for nightmare. And I want to talk a little bit about it because I didn't know that med existed. So Prazosin is a medication originally used for high blood pressure, but it's commonly prescribed for off-label for PTSD-related nightmares and sleep disturbances. So most likely out of this is probably the side effects that becomes the actual treatment for something. Just like how Viagra was created. It was created by mistake. It was actually a side effect. And guess what? How much they're making? Not even gonna go there. All right, so there's more in the description that you can read. Therapy, trauma-informed CBT, EMDR. Okay, that's for your PTSD related. Skill-based ADHD coaching and somatic or nervous system regulation therapy. They're all CBT, and I love the fact that for me, CBT works, and you really have to understand yourself. Make sure that you're honest about yourself. Make sure you're honest with your psychiatrist, your psychologist, medical professional, your GP, whatever. Okay, or else why would you even bother go to them, right? All right, so I guess the rest, it says none of there's also daily coping strategies. I can go through external structure, predictable routine, grounding techniques, short frequent breaks, and sleep protection. Validation, this really matters though. People with both ADHD and PTSD often hear, you're not trying hard enough. It is just anxiety. It is your fault. You have to handle this yourself. It is, you're the cause of it. My parents always say trauma explains everything. They dismiss you, essentially. Do not let them do that. If you do, please comment. I'll be there if you guys need. Thank you very much, and have a great day.